Okay, welcome everyone to the Keeping Your Business Together in a Crisis live stream webinar series. This is part 6 titled Opening Again, and we're going to be talking about the next phase of moving forward with opening up some businesses with the safer at home phase of getting back to normal, I guess I should say. This series is produced by the Boulder Small Business Development Center to support businesses in Boulder County as well as the rest of the state. We are one of 15 SBDCs in Colorado, and our center is hosted by the City of Boulder, and we're part of a fantastic team of local, state, and national strategic partners that can help you during these challenging times. We're recording this session at 10 a.m. on Wednesday, April 29th. I say that every time. I always give the time and date because things change regularly and frequently. And so we do record our sessions. We keep them on our website. And so you can always go back and listen. You will also get a recording via email to this webinar. It'll be sent to you tomorrow. And please note that we have everyone on mute, but we will be taking questions at the end of the session, or if you have questions that maybe you dialed in and you were like, I really need this answer to this one thing, please feel free to put that in chat. My co-moderator, Jamie Brandis, will be doing the Q&A after Zach speaks. And I just wanted to say a huge thank you to Zach Swank. He is the Business and Events Liaison for Boulder County Public Health, the COVID-19 team. They have been working tirelessly to try to find some structure to these, interesting times. So he's going to provide some guidance and share with you what he can today. I imagine we'll do more than one of these sessions as time moves on. And we do provide these webinars at no cost, and we'll continue to do so on Wednesdays at 10 o'clock for as long as they're relevant to you. So each week we do a different topic that, again, is something fresh, and we're hoping that you can walk away with a bit of information that helps you to continue on. So at this time, I'll turn it over to you, Zach, and we'll get going.
Great, thanks so much, Dizzy. Pleasure to be here with everybody. I want to start off by highlighting that much of the information I'm going to be talking about today is going to be relevant just to Boulder County, but there'll also be relevant information for folks outside Boulder County, but I'll just try and make clear when I'm talking about Boulder County specific information, because we are in a complex and ever-changing landscape, and it is tough to keep track of. So first, this is a Boulder County specific slide, just to sort of orient on where we're at on the timeline. Among other things, sort of simply, the state stay-at-home order came out on March 26th, and then Boulder County extended that stay-at-home order until May 8th. But we've also added in curbside. So if you live outside Boulder County, it may be different in your area, depending on what your local public health agency's chosen to do. But for Boulder County, we will fall, projected to fall under the state safer at home order starting on May 9th. Looking sort of out to the long term, everyone's asking me, where's this all going? What does this mean over the long haul? Nobody really has that answer, to be honest. It really depends on our behavior, how well we're able to test and isolate and quarantine folks that are sick or are exposed, how well we're able to follow the safer at home and stay at home mandates, and then also as well, the speed at which we're able to either develop a vaccine or treatment, or failing to do those things when we reach herd immunity. But I think the thing to keep in mind is that it's not going to be the end of May and we're going to snap back right to the way things were in January. This will be with us for months. So it's good to keep that longer time frame planning horizon in mind. So where are we now? Again, this is a little bit specific to Boulder County. We are still stay at home until May 9th. So that's the same thing we've been doing for the last 5 weeks, with the exception that curbside is allowed, and there is guidance on Boulder County's COVID page for curbside retail. And we're also preparing for safer at home. So safer at home, it is different in some ways than stay at home, but really the overarching message is that we still need to stay at home as much as possible, right? Like the virus itself has not changed. We're just ramping up our ability to test and trace contacts and using that as our means of limiting the spread of the virus. But all the same principles that we've been doing, social distancing, hand washing, mask wearing, staying at home except when necessary, all of those things remain critical. But there are changes coming for retail, field services, personal services, and limited healthcare settings, which would be, picture like your outpatient offices, chiropractors, things like that, and then offices at 50% capacity. Boulder County, so for everyone, there is excellent guidance from the state available about safer at home at the website linked here. If you scroll down on the page, there are specific guidances for each of the business category types that I had listed on the last slide, and there's excellent guidance there. Boulder County Public Health is also working with our local chambers, downtown development authorities, and economic vitality staff to develop a voluntary self-certification as a compliance aid for businesses to help understand, these ever-changing and complex orders. The Safer at Home order itself is 34 pages long and is a lot to digest, and relates to other orders. So we're working to distill that into specific guidance for each business type. And that is expected to be released Friday or Monday. And this is, again, it's a self-certification. Compliance with the order is required, but filling out this checklist is really, it's a compliance aid, not a requirement. It's there to help you, help your businesses. And in general, I want to highlight, this is a question that's coming up a lot. Hey, I see that gloves or masks are recommended for my business. I can't find them. Are you going to come shut me down? Because I can't find them. We recognize that this is new territory for everyone, and I think across the state, really enforcement is starting with education and working together and helping to solve challenges and problems together. Our jurisdictions, issuing orders to close or notices of violation or citations, yeah, but that's only after an extended conversation about what can and needs to be done. I want to highlight that tomorrow we have a series of feedback sessions that we've put together with the Boulder Chamber and other economic partners across Boulder County. You can find these sessions at the boulderchamber.com website. If you scroll down to the bottom, that image on the right-hand side of the screen is you can register for these individual listening and feedback sessions. We will be going over those draft compliance checklists and gathering general feedback. We recognize that you all know your businesses best, and I have a limited, and my team has a limited capacity to anticipate, the challenges and conditions that you'll face in your business as we're all trying to keep everyone's safe. And so the Thursday sessions are really an opportunity for businesses to share their feedback with us, and so we can take that under advisement as we finalize the checklist. And then on Tuesday, if you're not into giving feedback and you're the type that just wants the answers and just the facts and let's keep it straightforward, on Tuesday we'll have a repeat where we'll have those finalized checklists and another educational session. So you can sign up for either or both at the boulderchamber.com website. Other great places to go for information, bouldercounty.org, or your local county's public health page, the SBDC, of course, chambers of commerce, industry associations, your licensing agency, and the Colorado website, I find in general to be quite good. And that's the slides that I've prepared. I know that folks have a lot of questions, and so I wanted to make sure we had plenty of time to cover those. So with that, I'd open it up to questions.
Thanks,
Okay.
Jamie's going to
So,
there you go.
yeah, just trying to sort through these. We don't have too many yet, but everyone please feel free to enter them. So one person, I think you kind of covered this, but they just want more clarification. They're a massage therapist in Boulder. They've done extensive research with DORA, City of Boulder, Boulder County, and State of Colorado for a clear answer, but they just want to make sure, are they able to reopen on May 2nd? They say that they're ready with sterilization, masks, gloves, etc., but they just want clarification.
Yeah, so I'm going to need to I want to verify this, but Boulder is still under the Boulder County stay-at-home order, and so May 2nd, no, but May 9th, then we'll be under the state safer-at-home order. At least that's anticipated at this point. Yeah, so I would want to double check our Boulder County order to make sure, but if they haven't been able to be open already, then they can't be open until May 9th in Boulder County.
Okay, so someone is wondering where they can get the posters to display once they've gone through the self-certification.
Right. We will have those available on our bouldercounty.org site, as will the Chambers of Commerce, I'm sure. We're still working on developing those with the Chambers of Commerce, so I don't have them yet. But I think we're anticipating something to communicate to the public that, hey, we've reviewed the compliance requirements, we reviewed the safer at home requirements, and we're abiding by those, is the intent of the poster. And it would be a uniform thing across the county. So once we have that, it will be available on the bouldercounty.org page.
Okay, this will be translated in Spanish too, right? Sorry, Jamie.
Yes, we will have translated. Spanish. We will have Spanish translation. Yep. And we're working on getting a education session, similar to what I had in the previous slides, also in Spanish. We're just identifying the right staff member to help us with that.
Okay, this person is wondering what field services cover. They provide flight training and services at the Boulder Airport as the fixed base operator, and they're wondering if they would come under field services. So maybe if you can just provide clarification in general.
Yeah. So I'm just going to throw up. So here, does everyone still see my screen or no? Yeah, okay. You've got this Word document here?
Yep.
Great. So I'll make this a little bigger. So field services, I don't, looking at this list, I'd not previously thought about flight schools. I don't know that they would necessarily qualify as field services. Field services is really, you're going out and you're doing something at someone else's, typically residence. Where flight schools are happening, obviously at the airport. So I do not think that they would fit the field services category, but they're not going to fit neatly under any of the other categories as well. Perhaps personal services. We've got personal training, right? Different than flight training, but personal services is a little bit more about those sort of close interactions, and obviously you can't be 6 feet separated in a cockpit. So. But that's a good question.
So, yeah. So we're not really ready for best practices yet, but this person is really hoping that there can be specific recommendations for unique situations or industries, how other people are handling this. Again, this I guess is the same person with the flight training school, but they have very close and enclosed quarters as
right.
their type of environment, and they're not really seeing anything close to what they're doing in the safer at home policies.
Totally. Yeah, and that's where we're thinking of going with these feedback and education sessions. One of the questions we'll have on Thursday and on Tuesday is, are these something that folks want to continue? I know at least Gunnison County has been running weekly sort of COVID best practices sessions. And I want to say that, I'm not going to have all the answers of all the best practices for all the businesses because, I don't know your business. But we can develop them together and, your peer business as well. So maybe it sounds like there's a need for, a similar, flight school or, airport businesses and organizations to have a similar sort of best practices sharing group, and we would be happy to facilitate that.
Great. Are you able to share the list of business types with everyone?
Yeah, that I just had up on the screen in that Word document?
Yeah.
Yeah, I can. You can also access it yourself if you go to, so here's the Boulder Chamber. Here's the events you can register for. But if you go to covid19.colorado.gov and then click on Safer at Home, and if you scroll down, you have to go a bit, but here's that guidance that I was talking about. And you can either click in individually, it'll take you to a web page for each of these, or you can get an individual PDF version. But if you download the full guidance here, what that will bring up is, the best practices for work sites, for the employees, and then to protect customers. And then within each of these sections, they will have, this is where I pulled that list from. So office-based businesses includes, XYZ, childcare facilities include XYZ, et cetera, et cetera. So that same information that I had is available in this document here.
Great. So this is probably going to happen, but just wanting clarification. Do you foresee changes even after the guidelines come out? Businesses sharing, what's working, what's not, that type of thing.
Yes, change uncertainty is tough, and we've been through a lot of it. And it's also, I think particularly hard for planning a business. I totally understand that. Also, the conditions of the pandemic are evolving over time, and we want to be as responsive as we can as we're learning and as the pandemic's changing, to not stay fixed, static in one place. It could go both ways. I mean, hopefully it just goes in the positive loosening of restrictions direction, but if there was an increase in contagion and an increase in cases, then the state, Boulder County Public Health, your local public health agency, all have authority to protect public health. And if we saw a spike in cases, it's very possible we could end up back at a stay-at-home order. That's certainly not the scenario that anybody wishes to be in, and that's why we really want to do this rollout as methodically and carefully, and with as much guidance and clarity as possible, because we don't want to risk having to go back to a stay-at-home order. On the other side, I think this guidance, from the state and our checklists will continue to evolve as we get, as everyone gets experience with this, right? I think we've all seen the evolution of measures, at the grocery stores, with the plexiglass going up, and then, controlling the amount of people coming into the store, and having the markings down and the one-way lanes and all that. So most of us have never done this before, and so we're all learning, what works best for our businesses and what's safe. And so, I know it's frustrating to have guidance change, but we also want to continue to update with the best practices, both to allow the maximum opening up of our economy that's still safe at the same time. So yeah, keep looking back, at the websites for the most up-to-date information, and we'll try and communicate out when there's changes, major changes as we can. But of course, everyone is dealing with a flood of information right now. I get that. So just keep checking at the website for the most recent information.
Great. So this person is asking if it's possible to say no to someone coming into a retail store if they're not wearing a mask.
Absolutely. Yeah. Absolutely. If you make that a requirement for your business, yeah. I mean, it's kind of like the, no shoes, no shirt, right? No mask is now on that list, right? If that, that's up to you. But yeah, absolutely.
So there's some more industries that are asking some things, and I know you showed the list, so that's super helpful, but I guess if you can give any more guidance for some of these, great. One is kids summer camps. So
yes.
they're supposed to start here in a couple months.
Yeah. So
what do you think that looks like?
Everyone wants to know about summer camps. Everyone wants to know about events. What I am sharing now is the conversations that are having. It is not official guidance, and even if it was, it would only represent Boulder County. But the conversations that we've been having are, day summer camps, where that aren't overnight, seem very similar to us in operation to childcare facilities, which are critical. And so, with certain, safety practices put in place, we foresee that day summer camps would be possible. But like I said, we're still developing that official guidance, so don't take what I've just told you as gospel. But I know everyone wants to know, even where things are leaning, and I can say that that's where things are leaning at this point. For overnight summer camps, we're having to take a harder look at that. Obviously, there's higher contagion risks in that scenario, so I think that those would prove more challenging. So yeah, we'll see about that, but we know it's on the top of everyone's minds, and it's on our list to get guidance out as well. But some of it also depends on what's happening with cases locally and across Colorado. If we are starting to see an increase in case numbers, then of course we'll be looking at ways to keep that from growing and bring that down. And so it's a little hard, for some camps, school in the fall, events this summer. It's a little hard to project at this time, what's going to be feasible, just because we need to see where we're at with cases.
Okay, so another industry question is medical offices that are doing elective surgeries.
Yeah, and what's the question about it?
I guess just, are they able to open with the same timeline, or what does that look like?
Sure, yeah, so that'll fall under limited healthcare settings. So in Boulder County, starting May 9th, then those would be possible. Elsewhere, it depends on, if you're already under the Safer at Home or not. But yes, elective surgeries are coming back.
Okay, so this person is asking date-wise, the likelihood that it will be extended beyond May 9th at this point, since dates keep changing, what that might look like.
Yeah. I have not heard any internal indication that that's going to happen. That Boulder County would extend our stay-at-home order beyond the 8th. That said, I'm not the person who makes that determination. But at this point, everything that we're doing is gearing towards being out of stay-at-home on May 8th. So things look positive. Our case numbers look positive to support that. So my understanding is that that's where we're headed. Though I cannot guarantee that. But at this point, I would be surprised if Boulder County's stay-at-home order was extended.
Great. So this person is asking where they should send complaints if there is non-compliance, especially with Boulder County businesses.
Yeah. So if you go to bouldercounty.org, and this is great. I should have put these resources in the slides. There are a couple of resources. So if you go right up here at the top of the page, there's this Share Your Concerns link. And that's going to take you to a section on our COVID-19 page that will pop up shortly. Okay, so there's a couple of different resources here that I want to highlight while we're here. If you've got concerns about COVID illness, call the CoHelp line or email the CoHelp email address. If you've got other COVID-related questions, we staff a call center Monday to Friday, 8 a.m. to 6 p.m. So, if you've got a question about your business or any other questions, Workforce Boulder County is also using that same line. That's the number to call. If it's after hours, you can use the form. And if you have concerns about a business not following the stay-at-home order, you can use this online form, and then that will come to me and my team, and we will follow up on that. And for the businesses on the call, I want to emphasize that our follow-up is education-based first and foremost. Some folks understand the order better than others. Some people are concerned about things that are permitted and are okay, and then sometimes there's actual practices that need to be corrected. And I would say far and away, we've experienced, of the just about 800 submissions we've had through that form so far, far and away, everyone gets it and everyone understands, and we're able to resolve, whatever the issue is with just a conversation. And then finally here, if their concern is about gatherings of people, so this is, things, gatherings of people happening at a specific point in time, which is now. It's best to refer those directly to the appropriate dispatch, and they will go out and follow up. If you submit it to the call center or you submit it through the online forum, there's a little delay in folks, responding to that, and knowing that people were out playing basketball yesterday is not something that we can take action on. So if it's happening now, send it to dispatch. If it's a gathering of people. But all those resources are here. Again, if you go just to bouldercounty.org and then click the share your concerns link right up here at the top.
Okay, so I might have missed part of your answer to this when you started talking about the summer camps, but there are some more specific questions about events. So if there can't be any events, groups under a certain size, and this person actually operates a child care center. They normally host a new parent event, with orientations, parent talks, things like that.
Yeah, so under Safer at Home, it's less than 10 people. So that applies to events and businesses. So like picture like a barber shop. If you've got 3 employees, you can have 7 customers. If you got 5 employees, you can have 5 customers. So that's the 10 is the max. And obviously, the intent of all of this is, we want to keep ourselves isolated so we don't spread the transmission of the disease. And so there's what's allowed, right? And like, okay, yeah, like this kind of fits. And then there's, the intent of, really stay at home if you can, except for when you need to. And, something like a new parent orientation, if that could be done remotely, that would be better to be done remotely. If it's, by the nature of it, not something that can be done remotely, then yeah, you figure out how to make that work while still being able to maintain social distancing. Just want to remind everyone of, we often, businesses get into sort of the nitty gritty of like, okay, here's what the order says, and so I can do this, right? And I get that approach, but just want to remind everyone of the intent here overall is we want to be distant and physically separated as much as possible. And so anything that can be done remotely should be done remotely. Even if it's permissible under the order, but if you can do it remotely, much better to do it that way.
And is there any kind of estimate of when the number of attendees might increase, or group gatherings, that type of thing?
Sure. Let me pull up document here. So what I have on screen now is a document prepared by the Colorado Association of Local Public Health Officials. This is something that was shared with the state and with the governor. And what we're looking at here in this chart is, this green circle column here, that is the initial date of reopening. So for Boulder County, that is May 9th. And then, the projection here, if everything goes well, 4 to 8 weeks later, with no significant increase in cases, and we're meeting some of the criteria that are in this document above, we could see gathering size increase, from 10 to 25 to 50. And then 8 to 16 weeks after May 9th, we could see up to 250. If all of everything else continues to go well. I would take that as these things could happen, not they're a guarantee to happen. I myself, I know that we want to get back to normal life, but the idea of having a gathering of 250 in 2 months' time seems a little unrealistic to me. Just in terms of the the risk of contagion, and what we're doing here with the contact tracing and the testing, and beefing up our hospital facilities and all the preventative measures that businesses are taking, as we're getting better at mitigating the spread of the disease. But the fact that this is a highly contagious disease, does not and will not change. And so, I think, looking at this document, 250 people, that's going to be more like 16 weeks after, if that, not 8 weeks after, is my guess, just because of the the high risk there. But this gives you kind of a sense. Again, this is not a binding document. It's a recommendation, put together at one point in time based on the knowledge we had at that time. But it gives you a sense of what the thinking is.
Great. So this person is asking about the posters that need to be put up, and are those by industry as well, or is it just one standard for everyone?
Yeah, great question. I want to clarify, don't need to be put up, not a requirement. Using the checklist is also not a requirement. Compliance with the order is a requirement. So everyone needs to do that. But the checklist and the poster are just aids to help businesses with compliance. At this point, we are planning just a single poster, but as time rolls on, and with feedback, we'd certainly look at endorsing or creating more industry-specific posters. But we got a lot of things to get together in the next couple of days, and at this point, just a single poster.
Okay, so this person is asking, what category would outdoor recreation providers fall under?
That would be personal services. You're going to have that. I'm going to think about this. Yeah, I would think personal services. Still, potentially there'll be some crossover there with field services. You're not doing your activity at a manufacturing plant or at an office or at a salon or retail shop. But for me, I think the personal services is going to be okay. I don't know. I'm changing. It's a good question. It stumped me, to be honest. I would look at the guidance for both field services, and I would look at the guidance for personal services, and I would take from both of those what applies most appropriately.
Okay, so if you find that an employee is affected with COVID-19, will the store be shut down?
Yeah, that's a good question, and one that's coming up more and more, and is going to be with us for a while. It's very situational dependent. Boulder County Public Health has a team of epidemiologists who are handling those unique situations. Myself and the business and events liaison team have pressured them and said, like, we just want clear guidance that we can send out to everybody, and it'll be uniform and everybody will know. And it's just a little too situational dependent. So say you have an employee who tests positive, who's touched everything in the store, is a different scenario than an employee who tests positive who's working in a more limited capacity, right? It depends on how many people they've had contact with, and how close that contact was. And so it's highly situational dependent, and we don't want to have an overly heavy-handed response where every time an individual employee tests positive at a business, the whole thing's shut down, right? Like that doesn't that's not a scenario that anybody wants. And so we handle those scenarios on a case-by-case basis. There's processes and procedures put up. If you have individual questions, we're happy to answer those, or when that scenario happens, either we will be reaching out to you or you can reach out to us. Anytime there's a positive case, it gets referred to our epidemiologist team, and then they will follow up with the positive case and track, where they've been and what interactions they have. And then they will then go on and notify those people if they need to isolate or quarantine, or if changes need to be put in place at a business. One scenario where we can use your help is our notifications come in based on where the individual with a positive case lives. So pretty common in Boulder County for folks to live elsewhere and work in Boulder County. And so, if you are, work at a business and one of your employees, is tested positive and you're in Boulder County, we absolutely would love a heads up just to know, because hopefully, say the employee lives in, Broomfield County, hopefully Broomfield's gonna do that contact tracing and let us know that, hey, we've got a resident that works at a business in your county, and then we will then follow up. But if we can have the information coming from both directions, all the better.
So as a follow-up to that, with counties surrounding Boulder, is there any collaboration happening? Are there similar guidelines right now, or what's the communication looking like?
Yeah, so lots of collaboration. There's really strong collaboration between the Metro Denver public health agencies. That has been going on for years and continues to be strong now. We're also, no one's interested in reinventing the wheel and looking for, resources and materials and best practices that other public health agencies have developed across the state and across the country. And then there's also a lot of collaboration going on the interpretation and guidance side. So every time, I get a question that stumps me and I ask our attorneys, they will then reach out to their peer attorneys at other local agencies and coordinate to make sure that we're not giving a different answer than the county next door, or if we are giving a different answer, which we have done sometimes, we're at least aware of what our neighboring counties are doing and make an informed decision based on that. And the overwhelming, I can't tell you how many times I've heard internally that everybody wants to be coordinated and consistent as much as possible. And I recognize that that's not happening, always everywhere. And some of that has to do with, the unique conditions. For example, like the safer at home order, some counties, have low caseloads and have always had low caseloads, or, some have lowered theirs faster than we've been able to here. And so they're at a different point. You look at, say, Eagle County is a bit ahead of us in timeline. And so it's a balance of, of consistency with also not having too much of a blanket approach that's, reactive and tailored to the current local conditions. But yes, we're all very keen on collaboration and consistency and recognize the burden that having different guidance and different requirements in different counties puts on businesses.
Okay, great. So there is concern still about the number of tests and the capabilities to test people and employees. So if there isn't availability and an employee has symptoms that may or may not be COVID, is it just assumed they do, or is there a way that they can get access to more tests?
Great question. That is an evolving answer. We're everyone at every public health agency and local public health agency and across the state is working on getting more testing. I don't have a satisfactory answer to that question. We're we're trying to get as much testing as we can, and I would say, if the best thing to do, if someone is presumptive positive, or if you're uncertain, call that co-help line that I put up there, and you will get the most up-to-date, accurate information on testing availability, and they will help triage that scenario. So, I mean, obviously, the holy grail right now would be able to test everybody and provide testing to everybody. We're not there. We're working towards that. Don't know if we'll even be able to achieve that in the near term, but certainly we want to have the test for everybody who needs a test, and we're working very hard towards making that happen. But don't, if you're concerned about, if you, or one of your employees might have COVID, don't just assume that there aren't tests available, so I'm not going to bother. Reach out to that co-help line, get the most up-to-date information, because it is changing on a daily basis.
Okay, so there's questions about schools, and if you think they're going to reopen in the fall, it's really hard for employers to plan ahead if their kids are going to be home or not. And,
yeah.
Any guidance there?
I had no guidance there. Sorry. It's a little too early to say, and that's also out of my realm. Those decisions are being made by the school boards and superintendents, in consultation with our public health director and the folks on our policy team. So yeah, I'm not even going to hazard to wade into that conversation, but reach out to your school, reach out to your school to get the most information there. I can't guess on that.
So I'm thinking these parents are wondering, they want to be able to have activities for their kids to do since they've been cooped up and it's almost summer. So they're asking about swimming pools and other recreational areas. If you have any thoughts on when those types of things might open.
So pools fall into a couple of different categories. There's obviously your own backyard pool. That's your own backyard pool. There's pools at HOAs and apartment complexes. Those, by our interpretation of the Safer at Home order, would be permitted after May 8th only to the residents of that apartment complex or that HOA, and so physical distancing, social distancing would still have to be maintained. Outdoor, like club pools, think like the Elks pool here in Boulder. By our interpretation, and we're requesting further clarification on this from the state, but by our interpretation, again, with social distancing, that would be allowed, but that's going to be for lap swimming, not not a crowd of kids, where we can't maintain social distancing. Indoor pools, that's going to be a while still. More challenging, of course, in the indoor environment.
Okay, this person just wants more clarification about the 6 feet social distancing. Does it mean between employee and customers? Do they need to enforce it between customers as well as their staff members? Just some clarification on that.
Yes, is the answer. Obviously, you as an employer, you have greater leverage over your employees than you do your customers. Recognize that. So you want to encourage customers to maintain physical distancing, and certainly if you have a customer behaving inappropriately, you have all the rights and restrictions, that you have around, regulating any customer behavior, besides physical distancing, right? It gets back to that mask question. Like, can you require customers to wear masks? Yeah, it's your business. So things you can do to help with that, posting signage, things that you can do to help with, your customers, abide by the social distancing, posting signage, limiting the number of customers in the store, and there's lots of guidance on that, for retail under the Safer at Home guidance page that I showed earlier, as well as, our checklist is going to have best practices there. But demarcations on the floor as to 6 feet apart while waiting at the register, putting in arrows indicating one-way traffic through a store, putting up physical barriers, plexiglass barriers between your cashiers and customers helps, in that scenario where you can't have 6 feet. So look at, again, this state page. The retail section has a lot in here, and when we have our guidance out, our checklist out, there'll be even more in there, more recommendations. And we look forward to the excellent practices that Critical Retail have already discovered, and sharing those through our webinars on Thursday and on Tuesday.
Okay, so a lot of people are asking for all the resources that you're sharing right now, the phased approach and some of these websites and stuff. So if you can send those to me afterwards, as much as you can, I'll send it out to everyone.
Absolutely.
So that should answer a lot of questions that people are submitting right now.
Yeah.
So I think we have time for maybe one or two more. The people are saying they're really thankful for everything you've been doing, Zach. So really thank you for answering all this stuff.
And if folks have additional questions, we've got that call center staffed, 8 to 6, 5 days a week. So don't hesitate to reach out and ask. It's important that people have the right information and accurate information, for all of our safety. So we want folks to call and ask for questions.
Okay, so let's just do maybe one or two. So this person has engineers in the office, but then they sometimes go out to different work sites. So they kind of fall into different categories. So they're wondering how to navigate if they do fall into multiple categories.
Yeah, great question. We were just talking about this earlier, so the engineers are going to fall under, when they're out of the office, that's very much, this field services guidance here. But yes, you are also, partially an office-based business, right? And you may have some employees that are just entirely in the office. So you're going to want to look to, both sets of guidance as appropriate to the activity.
Okay, so let's just end with one more. So they're asking if every COVID case in a business needs to be reported, and I guess where to report it.
Yeah, great question. The definition of an outbreak under Colorado Department of Public Health and Environment's orders is 2 cases. So if you have two positive cases at your facility, facility being a business, facility being a nursing home, whatever, that triggers it being an outbreak, which has a set of reporting requirements and actions that follow. So certainly, if you have one case, we'd love to know about it if we don't already. If you have 2 cases, you have to report it to us. Send it to and I'll put this in the communication for to share out, but COVID violations at bouldercounty.org, and it's violations with an S. is a great place to reach out to, and we will connect you with the epidemiologist team. But yeah, in any scenario where you have 2 cases is an outbreak, which comes with mandated by law reporting requirements, and there's lots of details as to what that is, and you'll have support navigating that from our epidemiology team, if that occurs.
Okay, so we actually have time for one more, I think. So I'm just going to ask this. There's a limit on supplies that has been happening for a while. So people are wondering, in order to open up, they need some of these things like sanitizer, wipes, things like that, but it's hard to find. Do you have any suggestions for those folks?
Not yet, but we will. We are compiling a list of where we've been able to source supplies. I would say everyone should be working to get them from where they can. We think about the scenario where we've been in, where most of the country has been under a stay-at-home order, and it has been difficult to get supplies for the critical businesses that have remained open, for the healthcare workers who need them most. It's gotten better for those businesses, but now not just Boulder County, not just Colorado, but across the nation, we're starting to open up restrictions, and there is going to be tremendous demand for supplies. So we, like I said, we're working on putting together a resource that we'll share out, but I would not wait for that resource to come out. I would keep looking, because even once we send out our resource of where we've been successful, all of a sudden we're directing a lot more people to those sources, right? And you could easily see a similar problem. So yeah, it's a challenge. I recognize it, but I'd say best thing you can do is to keep looking on your own, and we'll share what we can when we have it. Yeah, it's gonna remain a challenge for everybody, and it'll probably get worse before it gets better.
Totally understandable. So I do want to thank you again, Zach, for doing this. I think this was really helpful. I think we were able to answer a lot of questions. And to everyone out there, things are evolving really quickly, as I know seems apparent. Dates are changing, guidelines are changing. So we'll continue this webinar series. This is brand new opening right now. So, we'll continue this and try to keep everyone informed. And Zach, you've been really great about sharing resources. And again, to everyone here, I will follow up with a lot of the stuff that Zach shared. So we make sure you have that information. Also, as the SBDC, we do offer consulting at no charge. So I know we have people around the state. So there are 15 centers, like Susie said. So you're welcome to go to coloradosbdc.org to find which center might be in your area, and they'll be better able to, give you guidelines for your particular county, since we do focus on Boulder County here. But we're happy to help, and the consulting, we're trying to put together a program that's kind of like a workout plan to help you get through this time. It's going to be a long process to get your business going again. We recognize that and want to be here as a resource to you. So Susie, if you have any other things you want to close with, go for it.
No, I think you did a great job, Jamie, and Zach. Thank you so much. This is great. I really appreciated learning about the resources and things as well. And, we just appreciate all that you're doing. So.
My pleasure. We're happy to help. And like I said, if there's any, we'll get the guidance or the documents out through this invite, but any other questions, we've got the call center, so don't hesitate.
Yeah, maybe one more thing. One more thing before we go. Jamie and I, as we continue doing these every week, if you have suggestions on topics that you want to learn about, feel free to reach out to us and let us know, because again, we're doing these specifically to help you learn what you need. So that's it. Thanks.
Thanks, everyone.
Thank you.